Hello, everybody, and welcome to tonight's webinar on peptides. My name is George, and as a member of the Infinity family, I would like to thank you all for joining us on this fascinating topic of peptides presented by our wonderful MPs, Melissa and Tanya. Peptides are what I call the miracle of treatments, and I'm sure that you will feel the same by the end of the presentation. Please do not hesitate to send any questions you may have during the presentation, or you may simply wait until the very end to ask your questions if you're so inclined. So please sit back and enjoy tonight's venture into the world of peptides. Take it away, Melissa.
Okay, hi everyone, good evening. I'm Melissa, one of the providers at Infinity MedSpa, and I will be here today to talk to you about peptides. This wonderful presentation was put together by my co-captain here, Ms. Tanya, the other provider, Infinity MedSpa. So kudos to her. So as we proceed, let us go ahead and talk about peptides. So what is a peptide? A peptide is a short chain of amino acids, less than 40 in a chain, and it enhances the body's natural production of hormones and peptides. The first peptide ever discovered was insulin, which is found naturally in the body, and this is noted to be depleted. That's why individuals get diagnosed with diabetes. The way that peptides work is they improve immune function, improve energy, sleep, muscle repair, libido, and so much more. The first peptide that we'll focus on is Thymosin Alpha1. It's a major component of thymosin fraction 5 found in the thymus gland. And the thymus gland is responsible for regulating the immune system, so it's super important. The Thymus Alpha1 is prescribed to optimize the performance of your immune health and improve the general wellness by preventing infections such as the common cold or the flu, or even times as these with COVID-19. You definitely, this is definitely something that you want to add to your regimen of protecting your immune system. What it does is it acts to augment the T cell function, and T cells are an important part of the adaptive immune system, which fights off infection. So again, this is definitely a peptide that's helpful towards treating disease in the body. It helps improve. This peptide was approved as an orphan drug to help treat viral conditions such as hepatitis B and C, and through its ability to stimulate the immune system. The FDA approved it for certain types of cancer treatments as well, because it helps the immune system find and kill the cancerous cells. So not only is it helpful towards colds and flu treatments and even COVID-19, it's definitely a great source for treating cancer. Since 1979, Thymosin Alpha1 has been evaluated in more than 30,000 patients in over 70 clinical studies. So obviously this is something that's been around for quite a bit of time, over 3 decades, and it's something that's been more and more showing promising results, and people just are in love with it. The way that this is, the way that you administer this peptide is that it's a self-injection once daily, subcutaneously. And we would go over that with you, either I or Tanya would kind of go over the instruction with you in terms of location of injection site, and how often to take it. And again, it's very easy and simple. Just one subcutaneous injection around the abdominal area twice a week at most. And again, it's well tolerated. There's no side effects other than injection site, which is, again, just a simple alcohol swab to the site, and no other issue. And again, there's no food or dietary restrictions. So focusing on our next peptide, the Peptides Polysulfate is a semi-synthetic polysulfated xylon used most commonly for the relief of osteoarthritis, but also they've been using it for interstitial cystitis or bladder pain. What it does is it has anti-inflammatory effects, which is awesome. And xylon is present in beech tree bark. So as you can see, it's a very natural substance to use. The mechanism of action in osteoarthritis is it's multifactorial, with both stimulation of cartilage matrix synthesis and prevention of cartilage breakdown. The recommendation of this dosage to be given is 2 milligrams per kilogram. So again, we would get your weight, we'll convert into kilograms, and then we would kind of go over what in how much you would inject via the syringe. And again, it's a subcutaneous injection twice weekly for up to 6 weeks. And again, this can be repeated. It's just we take a break period in between, about a month long. Common side effects include injection site redness, diarrhea, nausea, or headache. But again, this is possible side effects, doesn't necessarily always happen. And from understanding from clinical trials and patients responding, it's very much quick relieving. And there's no restrictions against food or alcohol. And the next peptide we'll look at is Thomason Beta 4. So Thomason Beta 4, it's a hormone secreted from the thymus. And the thymus, again, as we discussed in Thymosin Alpha1, is it regulates the immune system and also helps with tissue repair. And Thymosin Beta 4 has been found to play an important role in protection and regeneration and remodeling of injured or damaged tissues. So it's really great, especially if you're getting regenerative medicine treatments such as PRP or stem cell injections, things like that, because it really helps just starting this before, at least a month before your regenerative medicine procedure, and then getting the procedure done and then continuing with it afterwards is definitely helpful in terms of building that tissue restoration. It's prescribed for so Thymosin Beta 4 is prescribed for acute injury, surgical repair, and patients that were once athletes that accumulated injury over time. It acts as a major actin sequestering molecule. So again, this is definitely something that's beneficial for those that, they're trying to get back that function in their their extremities, or also just like that tissue repair in terms of post-procedures related to regenerative medicine, and also just overall just kind of maintenance of the body. And again, this can be taken after cardiac injury for better healing of tissue in the heart. And the recommended dose is 0.25 mLs via subcutaneous injection, again, around the abdominal area. And for daily for 20 days, and then we'd have a break period in between. But again, this is something that you can continue on for life. And it's well tolerated, no side effects, except for at the injection site, which again is very minimal as long as it's administered correctly. And there is no food or alcohol restrictions. So the next peptide we'll look into is one of my favorites that I've personally been taking. So it's the Somalin and the glycine. So Somalin is a synthetic hormone peptide composed of 29 amino acids. Somalin is a synthetic hormone peptide similar in structure to a growth hormone releasing, similar to structure to a growth hormone releasing hormone, so GHRH. It's commonly utilized to optimize growth hormone levels in adults and offers the variability such as seen in IGF-1 increase. So Somalin works to pretty much burn fat, increase lean muscle, improve hormonal balance, enhance energy, and boost the immune system by stimulating the production and release of the hormones by the pituitary gland. So its counterpart, glycine, plays an important role in control of the hypothalamic pituitary function, specifically impacting growth hormone release. So glycine is an amino acid that acts as a stimulatory agent, introducing the pituitary gland to secrete the human growth hormone. Together, Somalin and glycine make the ideal synergistic combination. The benefits of glycine go far beyond weight loss and enhancing lean muscle mass. So again, you can enjoy a better night's sleep, less daytime fatigue, enhancing your mental clarity and cognition. And there's definitely shows signs of significant improvement in skin elasticity, tone, texture, while enhancing synergistic boost to the IGF-1. So definitely this is something that is definitely gives you that overall benefit And the way that Somalin is administered is basically you'd have a subcutaneous injection of 0.2 mLs via wherever subcutaneous tissue is, most commonly in the abdomen. And it would be done 5 out of the 7 nights of the week. So basically, if you want to do it from Monday through Friday and then skip the weekends, kind of give your body a little break, that's very, it's up to you and your scheduling. And you want to take it 90 minutes after you've had your last meal. So if you're going to bed at like 10 o'clock, you probably want to stop eating around 8:30 and then give yourself the injection at 10. Again, side effects attribute to the effects of the growth hormone, because again, it works in similarity to natural growth hormone, and such as you'll notice is arthralgia, such as pain in the extremities, peripheral edema, carpal tunnel syndrome, and hyperglycemia. But again, these are just possible side effects, not a definite occurrence. And this product shouldn't be used with patients with cancer risk, just because of the factors of growth hormone, and we don't want to enhance the risk of anything proliferating or growing. Again, there's no food or alcohol restrictions. You may experience some flushing with this, which is a common side effect, but again, very minimal and short-lived. And then a very popular peptide is the Remelodine PT141. And this peptide was developed from the Remelodine 2 for its aphrodisiac properties. So unlike all the other sexual enhancement drugs, such as like Viagra or anything else on the market that acts on the vascular system, PT141 actually stimulates the sexual desire by acting upon the nervous system. So it improves sexual dysfunction in females and also induces erections in males and heightens the libidos in both sexes. And clinical studies show that PT141 has shown to improve 80% of effectiveness in males and 50% of effectiveness in women. And especially male, and in terms of the effectiveness in males, it definitely showed that it responded much better than those that didn't respond to Viagra, Cialis. So obviously, if you were a gentleman out there suffering and that Viagra wasn't kicking in, hey, maybe it's time for you to look at some PT141, and and to satisfy that woman in your life, definitely this is something that she would also be able to partake in. So the way that this is administered is it's an injection of 0.2 ml subcutaneously as needed, and you want to do it at least 30 minutes to 6 hours prior to any sexual activity. So kind of get it, when that save, get ready for that special occasion. And as with all the other peptides, there's no food or alcohol restrictions. So just go over a list of all the other peptides that we're offering, and just a brief summary of each is we have DHEA, which is an aromatase inhibitor, and that helps with hormonal support. So DHEA is produced by the adrenal glands, and it's the highest circulating steroid present in the body. And what it does is it helps increase testosterone and estrogen levels. So it's very important. And then we have arginine and lufacil, excuse me for my pronunciation. And what does that help? And what that helps with is wrinkle and muscle relaxer. Then we have GHK Cu, which is copper is infused in this peptide. And what this is it's good for wound healing and collagen stimulation. So this is a great thing if you're someone that's, gets a lot of, treatments, keeping up to date in terms of skin maintenance and things like that. You're trying to maintain that collagen growth, and also any types of, if you, recent injuries and things like that, this is awesome to add on to the peptide collection. Then we have Rampicin cream, which is good for skin improvement as well. Then we have Serene, which is an awesome peptide used to help those suffering with anxiety. It's a natural way to kind of, keep your anxiety levels at bay, especially if you're not one to seek other types of anti-anxiety medications such as Ativan. And then we have PTD, DBM, which is which helps with androgenetic alopecia, hair, and then also with, overall hair loss. And you can combine this with regenerative medicine treatments such as hair restoration, when you get post PRP injections or stem cell injections into your scalp, you combining this PTD, DBM, post that treatment would definitely enhance the effects of it. Then we also have tadalafil. Can you tell my English is good? Alzheimer's, which helps with Alzheimer's prevention and erectile dysfunction. And then we have our Melatonin 1, which this is great, especially those who, have troubles tanning, etc. What this does is this peptide helps to enhance your skin's ability to, be able to, kind of penetrate that sun more into your skin. So you have skin tanning, and it helps with vitiligo, as well as CIRS, which is chronic inflammatory response syndrome, aka known as mold illness or bacterial, fungal, and viral infections. So obviously it's a great thing to add in combination if you're someone that likes to tan, but you kind of want to get a little darker, but you're trying to avoid those tanning beds, something definitely to consider. And then we have apomorphine, which also helps with erectile dysfunction and libido. Then we have oxytocin, which is something that probably commonly hear when mothers are giving birth, but also it's noted to help reduce appetites and also for orgasm improvement. And both men and women can take this peptide. We also have another peptide called enclomiphene, which is a testosterone optimizer and helps with testicular stimulation. Then we have a very popular one such as deep sleep. And if you're, someone suffering with insomnia, or you're just really trying to get a good night's rest, definitely, deep sleep helps with sleep quality and helps improve the latency improvement. So you're not, waiting up as late at night to fall asleep. Then we have our next peptide is Scream Cream, which helps get that orgasm effect during sexual intercourse. This is primarily, applied onto the woman's area, and as well as men can use it, but definitely something that would be great in combination with the other peptides, such as, the PT141. And then for our next peptide is the aminophyllene and the glycyrrhetinic acid, the transdermal cream. And this is really popular in terms of it's a topical cream used to help with that fat loss. So kind of like if you have any areas of concern, such as around love handles and things like that, you just apply this cream. What it does is it helps break down the fat in that area. And then our last peptide here on this list is our Trimix, which is the third peptide that we have here that helps with erectile dysfunction. And this is, a simple injection, but it goes a long way.
I guess there are no questions from the floor right now, but I do have some questions that came in. So if we may. First question, can I use peptides as an alternative to retinol?
Well, George, let's answer that. So yes, you can use peptides as an alternative to retinol, but honestly, they kind of work differently. So you can use peptides alternative to retinols, but you also can use them in conjunction because again, peptides offer impressive collagen boosting properties, and some people see peptides as less irritating alternative to retinol. So both have different awesome selling points in terms of use. So peptides tell the body to produce more collagen in order to plump and soften the appearance of wrinkles at the surface, while retinol targets, cell turnover to address everything from wrinkles to the pore size to uneven pigmentation, which is often slightly more, benefits as you're, aging. Over time, the skin is changing. So you can easily use retinol-based products in the same routine as peptides. So it's not like you have to give up either or. You just want to make sure that you're not overdoing it. You can just make sure that, obviously if you notice any increased redness or peeling or anything from using your retinol, again, be wise in terms of distributing how often you're applying it. But again, you definitely can use both in conjunction. There's no qualms about it.
Okay. Thank you, ma'am. Number 2, which are the most popular peptides I need to look out for?
So as we discussed in the webinar, we tried to focus on the most popular ones that we offer here, but the last slide definitely was able to kind of give you an overall view of how much is actually out there. And I don't even believe we listed everything of all the peptides out there. So honestly, the sky's the limit. But the primary ones that we like to focus on are the Thymosin Alpha1, which is the one that is derived from the thymus, and it helps against viral infections, cancer, vaccines such as hepatitis B and C, autoimmune, immune related senescence, and also the CIRS, which is the chronic inflammatory response syndrome. Again, there's the other one, peptidin polysulfate, which it helps with osteoarthritis and any anti-inflammatory issues. Then we also focused on the Thomason Beta 4, which is great for, tissue repair and regenerative treatments such as, stem cell PRP and also hair regrowth. And also if you're, an athlete and, in terms of performance, helps with that wound healing. And then just overall, just kind of keeping your body in balance is really great. And then we looked at Somalin Glycine, which is similar to growth hormone that we produce in our bodies, and that helps with the repair and recovery and overall body composition and energy that's high, and and it helps with energy, and also helps manage elevated CRP levels and triglycerides, so the inflammation in our bodies. And again, this is a great peptide to add if you're looking for that, don't know how to start or where you kind of want to explore the realm of peptides, and you want to try something new that will kind of touch upon everything on your body. Definitely the Somalin Glycine is definitely something to look at. And then like I said, our popular one is the PT141, which helps with sexual arousal. And that's something that you would take, 30 minutes or 6 hours before sexual activity. So you just kind of figure out after you've used it a couple of times, what's the right time frame for you to have that good time. But aside from that, those are definitely the ones that people have been asking about. But again, as you saw previously, there's so much more that can be offered.
Thank you again. Next question, how can I introduce them into my routine?
So good question. Honestly, it's something peptides can easily be added to any routine, whether you're doing aesthetic procedures, like I said before, regenerative treatments, any post procedures, not including regenerative treatments such as microneedling or, plasma pen, et cetera, or even just, again, if you find that you're getting ready to go to surgery, God willing, you don't have to, but like in terms of joint repair or anything like that, again, that's something you can put a peptide to that. Or even just you're looking for that overall just kind of balance back in your life, energy, quality of sleep, just feeling good. There's a peptide for that. So honestly, the sky's the limit. Again, kind of like we touched upon our popular ones, and I briefly went over a summary of the ones that are available, and that was just a short list. But definitely that's something you can easily implement into your daily routine. You could literally start that night that you receive the peptide. So it's not something that is a hindrance in terms of your everyday use. And they pretty much, since they're made to work well with your body, side effects and any contradictions with other medications are pretty much null and void. So great options to choose from.
Okay, thank you. The next question has to do with storage. Once I get the peptides home, how should I store them?
Okay, good question. So peptides, once you get them, depending on if you're using them right away, you would store them at the fridge at the temperature allotted in your, refrigerator. But you can store them if you've gotten like a long, because you can buy them in bulk, especially if you're traveling from ways to get here, and you would put them in the freezer, making sure that they're in the deep freeze, less than 15 degrees, negative 15 degrees Celsius, and they can be stored up to like 6 months to years. Only because it takes a while, while before the peptides even begin to degrade. As long as they're frozen, they'll still be very potent. Here, 6 months, years to come. We're hoping that you use them, right away, so that you're not conserving it, and that you're more than welcome to buy more, obviously. And these peptides have been shown to be very viable, even months on, years on end. So definitely something that you don't have to worry about, like having to discard them early. The only thing is you want to definitely make sure that you're not keeping them at room temperature and you're not storing them in direct sunlight, because we're trying to maintain the integrity of the peptides. But again, it's very simple to care for. Maintenance is, in terms of keeping the peptide intact, is just simple and just something that you just kind of can take out the fridge like your glass of milk.
Okay. Can you take peptides orally?
So there are some peptides that they do recommend, or that you can take orally, but they really highly are trying to focus more on peptides that you do subcutaneously, which is injection, or like sublingually under the tongue, things like that. Because what we're really trying to do is bypass the whole stomach area, where we don't want it to be broken down, because we really want it to get to the affected areas and get into the bloodstream to kind of act on and do its thing. But again, this is something that you could do. The more common ones that are taken orally have higher amino acid chains, but again, you can take them orally, but again, most peptides are taken subcutaneously because they have a higher viability that way.
Next question is, how much variability is there from one batch to another? In other words, I get one this month and then I get another one next month. How much variation is there between the two? Do I expect the same behavior?
Okay. So just like when you're, if you were to bake a cake, you know what I mean? Not every single time the ingredients are the same, but basically it should taste the same once you're done at the end results. And that's the same concept with creating peptides. With basically each time they've done it, they try to follow the same standard protocols and synthesis of purification. But again, as with anything else, there may be some variability, but honestly, the effects and the overall use of the peptide does not change. So again, you don't have to worry about anything off the charts being inserted in. And again, nothing's ever 100% in terms of like matching up the levels of content in each thing, because again, we're trying to make these into good chain peptides, but again, using the same standard protocols and synthesis purification, you're definitely going to get a viable peptide to use.
Okay, great. Thank you, Melissa. I appreciate that. And I got to tell you one thing. I'm very thankful I didn't have to pronounce those names. I think that's a major task. So when I take the time, and thank you all for attending this evening. I do remind you that this webinar actually has been recorded and it will be available for your viewing in the very near future. So keep an eye on our website and don't hesitate to give us a call if there's anything we can do and help you. Of course, www.infinitymedicalspa.com is our website. So feel free to access it at any time. Thank you again. And we hope that you enjoy the benefits of the peptides one of these days for the happiness and improvement of life. Of course, to feel good.